has been a very difficult Christmas for many South Africans. While we all enjoyed ourselves, let's not forget the fact that 14,828 new COVID-19 infections were recorded yesterday. That is what we look like the day after Christmas, South Africa. Sadly, 30 more people lost their fight against COVID-19 and passed away. The Western Cape is now the country's hotspot with over 3,700 cases. KwaZulu-Natal, which actually held that position for weeks now, is in second at the moment with just over 3,600. Then we start to come inland. Gauteng recording over 2,700 cases. The Eastern Cape reporting 1,720, while Limpopo, the Northwest, the Northern Cape and Mpumalanga, as well as the Free State, all had under 1,000 cases. They seem to be holding steady there. Let's hope it stays like that. What about the positivity rate? Well, it has come down a little bit in the last 24 hours. It now stands at 25.7% with 57,643 tests conducted. Well, the South African Medical Association says it does support the Health Department's new contact tracing, quarantining and isolation protocols. All contact tracing no longer applies to individual cases unless there's been a cluster outbreak. A quarantining of people in contact with COVID-19 patients should be stopped with immediate effect. Health authorities say there's no evidence that these measures are effective at all in dealing with the Omicron variant. In fact, the Medical Association's vice-chairperson, Mvuyisi Mzukwa, says this move should have actually come a lot earlier to avoid a crippling impact on the economy and also the healthcare system.
This should have come a little bit earlier, because we know that we have lost a lot in terms of the economy, and also this has put undue pressure on the healthcare facilities, especially those primary healthcare facilities. So I think we welcome what has come out from the Ministerial Advisory Committee. But besides that, I do think many people have not been educated. There was no time to explain to communities, before we give vaccines, in terms of explaining to them what it means to be vaccinated and what are the side effects, what should they expect, all those things. You can't just give a jab without explaining those things. It happens naturally in clinical practice.